Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I will be talking about a very interesting and a challenging case of an AutoKidney transplant that was recently performed at Sir Ganga Ram Hospital. In this interesting case, the doctors reconstructed what we saw as a 25 centimeters of damaged or missing ureter using the wall of the urinary bladder. This was an AutoKidney transplantation procedure wherein the doctors transplanted the patient's own kidney from the left to the right side, bringing both the kidneys on the right side. This is what Dr. Vipin Tyagi, who is the senior consultant at the Department of Urology and Kidney Transplant, Sir Ganga Ram Hospital, who operated on the case, had to say.
This young patient came to me with a history of stone in the left ureter. Ureter is a tube which connects the kidney to the urinary bladder. Unfortunately, at the time of the stone removal in some private hospital in Punjab, the ureter also came out with the stone. So now there is no connection between the kidney and the urinary bladder. So kidney is lying alone. In these type of situations, we have three options. A, we just take out this kidney because without any drainage of the urine, the kidney has no role. B, we connect the kidney and the urinary bladder by using an intestinal loop. Or C, we do a kidney auto transplant, in which we take out the kidney from the back of the patient and put it as near to the bladder as possible so as to bridge the gap between the kidney and the urinary bladder. We opted the third option, which is the best option. A little bit complex, but yet it is the best option. We took out the kidney, which is a complex procedure itself because it is an operated kidney, and then we transplanted this kidney into near the bladder on the right side of the patient. The next challenge is to make a tube. We have decreased the gap between the kidney and the urinary bladder, which is normally about 25 centimeter, to 4 to 5 centimeter by placing the kidney on the right side in the lower abdomen. But that 4 to 5 centimeter gap need to be bridged with a tube. We use the wall of the urinary bladder to make this tube and we'll bridge this gap.
He further added that in a normal patient, there is one kidney on the left and one on the right side and two ureters connecting these kidneys to the bladder. But in this case, we were surprised to see the left kidney lying alone without any connection with the bladder. He further added, since the patient was young and the intestine is not the ideal substitute for the ureter reconstruction, they decided to perform AutoKidney transplant, which means in this patient, taking the normal kidney out from the left side and bring it as close to the bladder on the right and connecting it with blood vessels going from the abdomen to the right leg, which is the external iliac vessels. Now both the kidneys were on the right side. Dr. Tyagi further added, now that the kidney was close to the bladder but with the gap of 4-5 centimeters, now we had to bridge this gap. For this, we decided to reconstruct a tube of 4 to 5 centimeters using the wall of the urinary bladder. As soon as this reconstructed tube was connected to the bladder, the blood flow to this kidney restarted and immediately urine started coming out through this tube. However, there were other doctors at Sir Ganga Ram Hospital who shared their valuable comments. According to Dr. Sudhir Chadha, co-chairperson at the Department of Urology, Sir Ganga Ram Hospital, seeing the complexity of the case, this was going to be a challenging surgery. The options before us were either to remove the kidney or remake the missing connection between the kidney and bladder by using the intestine or perform kidney auto-transplant. While according to Dr. Harsha, Jauhari, the chairperson at the Department of Kidney Transplant, Sir Ganga Ram Hospital, there are three kinds of organ transplants, that is the auto-transplant, allo-transplant and Xeno transplant. Auto-transplant means transplanting one organ from one place to another in the same human being. Allotransplant means transplanting organs from one individual to another, and xenotransplant means transplanting organ from non-human source into the human being. So if we talk about the patient in the end who underwent the procedure, he recovered well and recently was discharged with both the functioning kidneys on one side of the body, that was the right side. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.